So when you talk about your hematocrit, okay, so I want to see if the patient, if the person has anemia. Usually we rely on symptoms, but numbers tells me quantity, okay, a measure of your red blood cell. So if I do a hematocrit, I can identify if a person has anemia or not, okay? It's a measure of the percentage of red blood cell. So the males have 47% plus minus 5, females 42%, okay? Now, how do we do hematocrit? Hematocrit is done by getting a sample of your blood, okay? Put it in a test tube and then centrifuge it. So whatever is heavy will go down at the bottom. Okay, but remember your cell components is made out of leukocytes, platelets, and erythrocytes. So generally, all the things that you see here are your erythrocyte. Okay, so the foam that you see on top, we call it a buffy coat. Okay, and that's actually made out of leukocyte and platelets. So that's called a buffy coat. Okay, and then what's left on top is plasma. Okay, now how do we do a hematocrit? I'm going to measure the amount of blood volume that I got out from your test tube. Let's say I got to measure it about 100 millimeters. Okay, and then measure the amount of red blood cell. Okay, here. Let's say it's about 47 millimeters. So now I can do a hematocrit by computing for your amount of red blood cell, 47 millimeters over 100, multiplied by 100 to make a percentage. So your hematocrit is 47%. And 47% is normal for males. Okay? So that's the way to identify quantity, okay, using a hematocrit. Okay? Now, let's take a look at the components of your blood, okay? First is the fluid portion of your blood, about 55%. That's going to be made out of your plasma. And what's inside of this plasma is actually 90% water. So 90% of that is water, okay? And what else is actually seen in that? You have the electrolytes, sodium chloride, and then nutrients, sugars, amino acids, lipids, waste, and proteins are actually seen in that plasma. And the three main proteins that are seen in that plasma is going to be the albumin, globulin, and fibrinogen. Remember, this is something that you will actually talk about in physiology, okay? So albumin, okay, is produced by the liver. So let me actually just summarize what albumin does. Albumin is actually floating in your plasma. What it does, it actually prevents water from leaving your blood vessel, okay? So it actually maintains the water content in your blood vessel. Globulins are proteins that actually are helpful for the immune system, okay? And then fibrinogen is the one that used by the platelets for clotting, okay? So immune system uses the fibrinogen and they use it to clot, right? So generally those are the three main proteins. Now for your form elements is going to be the erythrocyte, leukocyte, and platelets. So those are the form elements. Erythro means red, cyte means cell. It's Latin. So this is your red blood cell. Leuco means white cell, white blood cell. And your platelets, sometimes you call it thrombocyte. Thrombo means collect. So they sometimes put a stain in order to identify the different types of your white blood cell, okay? And we'll discuss that because the main purpose for this is to identify what does a white blood cell. Well, they identify it, they put quantity on that. That's one of the most important things. Okay, so this is what we have right now. So when we take a look at your erythrocyte, I actually noticed that you have no anemia, okay? Because you're at the 47%. And well, I want to know, okay, the leukocyte number. So your doctor will actually order what we call a CBC. We call it complete blood count. Complete blood count, let's say your red blood cell is about 5.2 million per cubic millimeter. That's normal. And then your white blood cell, normal is about 11,000. And suddenly it went up to 19,000. So there's an infection there. So an elevated amount of white blood cell means there's an infection. So I got my red blood cell normal, and my white blood cell is actually elevated, and my platelets is normal. Platelets is about 150,000 to 500,000. Okay, so we need numbers here because that's actually the reason why you diagnose a patient. Okay, so I'm concerned about my white blood cell, elevated one on white blood cells. So the patient came in because of fever. Now the main point is this: what is the organism? Why did the white blood cell elevate? So I want to be sure, because remember, there's different organisms that affect humans. Okay, I want to be sure if it's bacteria, virus, fungus, or parasites. So now the order is going to be a differential count. So when I ask for a differential count, I want to see how much different white blood cells are there. Okay, so in leukocytes, white blood cells are actually two kinds, one with granules and one without granules. So the one with granules, they're actually called BEN, B-E-N. Again, mnemonics, BEN. Now the other one without granules, we call it LM. So what do I need? I need numbers. I need basophils, how many percentage there are. Basophils are actually 0 to 1%, the least amount of white blood cells generally. And then eosinophils is 1 to 4%, okay? And then neutrophils, that is about 40 to 70%, and that is the most amount. The most amount. Least and most, okay? So now your dip count, okay? I want to see how many BEN is there in LM. If I notice that my monocytes, neutrophils, and also basophils is elevated, that's a bacterial infection. So now it actually, you understand now why the patient has fever. It is a bacterial infection. So monocytes 48%, suddenly it's 12 to 15% now. Your neutrophils is at 40 to 70%, now I got 85 to 90%. And then basophils, 0 to 1%, now I got about 7%. Usually basophils is a sign of inflammation, okay? So this is what I rely on. I want to know what organisms there are, because remember, if that is the elevation of the MNB, that is a bacterial infection. And that is a prescription for antibiotics. How about my lymphocyte? So what makes the lymphocyte elevated? It's cancer, virus, and fungus. So now I know that there's no antibiotics required. Why? Because antibiotics only kill bacteria. Virus cannot be killed by antibiotics. We only give antibiotics in a viral infection if the viral infection is 10 days already on its lifespan. But if it's a virus infection, I would actually just say, hey, patient, go home, take a lot of water, get vitamin C, and make rest. And then if you have fever, just take acetaminophen. Because antibiotics does not work for virus. Now, how about my E? My E is eosinophils. If there's an elevated amount of eosinophils, it's parasites or allergy. So that's the reason why I need my diff count. So we should usually order CBC with diff count. And why? Because I wanted to know what organism does this patient have. So does that make sense about the information I give you, in which we're actually just in anatomy, I'm just actually telling you the granulocytes, cells with granules are BEN, okay, and cells without granules are LM. And that's how we analyze a person or a patient, okay? So that is the reason why we need to know all this information about our blood, okay? Especially the blood cells. So how do we actually know how many of these white blood cells in your blood? We actually do a blood smear. So we put a drop of blood in a slide and identify the different cells in the blood smear. So we will actually identify the red blood cells. It doesn't have any nucleus. That's the characteristic of red blood cell. That's the reason why they only live for 120 days. And I've noticed that the central part is pale. We call it central pallor, okay? Because the red blood cell is biconcave. So this is what I know about erythrocytes. No nucleus. The one that has nucleus, those are my white blood cells, okay? And remember, we count this different white blood cells, and usually the person that counting it is not a person, it's actually a computer. So I want to see how much is my neutrophils, how much my lymphocytes, how much my monocytes, and how much my eosinophils, which is not in this blood smear, and then that will likely give me an idea of the status of the patient. So this is one of the reasons why we have to study blood, because I need to identify how do we know it is a basophil, eosinophil, neutrophil, lymphocyte, and monocytes, okay? And that's our topic today. Okay, now let's go on. This is what red blood cell looks like, okay? It's biconcave, okay? Biconcave, it is biconcave, and that's the reason why if you take a look at the middle part of it, it is pale. We call it central pallor. And remember, no nucleus in this cell. And that's the reason why this cell only lives for 120 days. Unlike the white blood cell, they have a nucleus, they live longer, okay? Now, the purpose of the red blood cell is to transport oxygen. Oxygen is transported inside the cell, and that is because of a protein. We'll talk about that protein later on. Now, most of the quantity that you want to know about your red blood cell is about 5.2 million cells per cubic millimeter. It means if I have a small cubic millimeter box, inside there is 5.2 millimeters, okay? So that is how we get a quantity. So the machine will actually count the number of red blood cells, okay? So 5.2 is the normal value, okay? And remember, it doesn't have organelles or it doesn't have nuclei, and that's the reason why it lives only 100 to 120 days, okay? So it's temporary, okay? Now, what is inside the red blood cell is a protein called hemoglobin. The hemoglobin is a protein that carries oxygen. Now, if you take a look at hemoglobin, the most important part of hemoglobin is iron. So if somebody has anemia, the first thing that the doctor will always recommend is actually give iron, because usually the most common type of anemia is iron deficiency anemia. Okay, because one of the most important thing about hemoglobin, it needs that iron to form this protein. And if you noted also, in that hemoglobin, there's actually two areas where the oxygen can sit. Okay, it's like an Uber taxi. This is where the oxygen sits. It's located at the area that is on the globin. Okay, so that's actually the area where the oxygen sits. So if you notice here in this animation, the oxygen sits on those four areas. That's the reason why hemoglobin is important. And remember, red blood cell needs to bring this oxygen to the different tissues, okay? Now, red blood cell originates in the bone marrow. That's where it's created at. We studied that in our skeletal system. Remember this spongy bone, the red marrow? That's actually where this red blood cell is produced, okay? And the shape is important, okay? Why is this important? This blood cells, the red blood cells, when they pass through a capillary, the capillary is connection between the arterial and venal. They go through a single file, okay? So they go through a single file. The capillary is so small that the shape of the red blood cell is important so they can squeeze through that capillary, okay? Now, if you have a sickle cell, blood cell, that blood cell gets stuck on the capillary. So now the other blood cells cannot pass through, okay? Because the edges here is not refined on the sickle. So they get they get through the capillary and they block the movement of the other blood cells. So that's the reason why the shape is important. It has to be biconcave, okay? So that it can squeeze through the capillary easily. If it's sickle, sometimes the shape, they get caught onto the capillary and that blocks the blood vessels so that there's no oxygenated blood going here to this muscle. And that's the reason why it's really important to have this shape, biconcave shape, okay? So that's the answer to this question. Right, so my white blood cell is about 11,000 cubic millimeter per cubic millimeter. So the purpose of this is to protect the body from all microorganisms, okay? And you see that they function outside the bloodstream in the loose connective tissue. So you have a lot of this white blood cell. If you notice on the study of our tissues, you see a lot of these white blood cells already residing on the tissues outside the blood vessels, okay? And they escape through the blood vessels through a process called diapedesis. So a blood vessel has pores. So this pores allows the white blood cell to squeeze through that hole. And then when they squeeze through that hole, now they go into the tissue, okay? And that process is called diapedesis. So they get attracted to the infection because they, some of the white blood cells are already encountered bacteria here, okay? They secrete what you call chemicals, so-called cytokines. So when they secrete that, it actually attracts the other white blood cells that's actually floating in the blood vessel, okay? And that is actually the reason why, they go through the process called diapedesis. They squeeze through the pores, okay? Now, so we talk about the two type leukocytes. We call it granulocytes, and that's going to be Ben. Basophil, eosinophil, and neutrophil. And now a granulocyte, that's going to be LM. Leukocyte, monocyte, okay? Now, if you take a look at your distribution of the different white blood cell, we call it a differential count. These are my numbers, okay? The least is basophil, the most is neutrophil, okay? So we got a granulocytes, lymphocyte, monocytes, cells without granules, okay? Because now we need to identify the different white blood cells with granules. Okay, so this is what a granulocyte looks like. Okay, it has granules inside. Okay, so this is exactly what it looks like inside. Granules, cells with granules. And remember, white blood cells always have nuclei. Okay, so how do we identify the granulocytes? The granules. Okay, but remember, aside from the granules, how do we identify the different kinds of granulocyte? We have basophil, eosinophil, and neutrophil. Okay, so the first thing is, if you take a look at a basophil, okay, remember the word basal means basic, phil means attraction to. It get attracted to the basic stain. So what they do is they actually turn blue. The granules turn dark blue. And that's how we identify a basophil. So a cell with granules and granules dark blue, that's what a basophil looks like. Okay. The eosinophils actually is your cell with granules, but the granules is red orange, okay? And that's how we identify a eosinophil. Now remember, eosino means red, phil means attraction to. Eosino also means acidic, so it gets attracted to the acidic stain. The granules turn red, okay? And that's how we identify a eosinophil. Now the neutrophil, okay, the neutrophil is a cell that does not like basic stain or does not like acidic stain. It's neutral. So it has granules, but the color is actually pale. So the granules are pale, but you still see granules there. So the only way you can identify this is the number of lobes of the nucleus, because the nucleus, you can still visibly look at the nucleus. We got 1 lobe, 2 lobes, 3, 4, 5, okay? About 2 to 6 lobes. And that's how I identify my granulocytes, okay? Remember, there's only 3 types. Basophil. Basophil is always associated with inflammation. Eosinophil is associated with parasitic infection and allergic reaction. Neutrophil, that's actually the one that becomes a phagocyte, okay? And it's associated with bacteria, okay? So these are my granulocytes. So this is what a basophil looks like, okay? Dark blue granules inside. Okay, sometimes you can even see the nuclei inside. Usually it's about 2 lobes, but the nuclei is not visible, so the only thing you see is dark blue granules. Now, this one is going to be my eosinophil, okay? My eosinophil, reddish granules. Now, take a look. This is a parasite, a worm. And take a look what the eosinophil is trying to do to that worm. It's attacking it, okay? That's why if your eosinophil becomes elevated, then you probably have parasites, okay, aside from an allergy. So this is what eosinophils actually does. And this cell has reddish orange granules. Now the neutrophil is actually white blood cell that's phagocyte. See that the white blood cell is actually eating up that bacteria. It's a diplopocide. That bacteria is running away from that white blood cell, and suddenly he ate it. Okay, so that's what your white blood cell neutrophils are for. Okay, they are destroying bacteria. Okay, now remember to identify 2 to 6 lobes, and the granules are pale. Okay, so the granules are pale. Now the next one is going to be agranulocyte, means without granules. So the one without granules, we have LM, lymphocyte and monocytes. Okay, those are my 2 types of cells without granules. My lymphocyte, there's 2 kinds. I got a T cell and a B cell. Okay, T cells, generally they're actually attacking the cell directly. B cells, they're the one that creates antibodies. I don't want to go over this because you guys are going to take it in physiology, but the T cells are cell killers. And the B cells are the one that produces antibodies against infection. So the 2 types, they're called lymphocytes. Okay, so lymphocytes, how do we identify how a lymphocyte looks like in a monocyte? No granules. The things that you see here inside the cell, they're not granules. Okay, so no granules on the cells. And if you notice, the lymphocyte, the description of lymphocyte, the nuclei is as big as the cell. That's how you identify a lymphocyte. Okay, now the monocyte is the largest leukocytes. Okay, again, let me stress that out, largest leukocyte. So the way to identify a leukocyte is the nuclei looks like a kidney shaped. And that's what a monocyte looks like. Okay, and remember, this cells produces what we call phagocytosis also. They become macrophages, right? So my T cells, if you take a look at T cells, this is a T cell. Take a look at this T cell. He's destroying this cancer cell because remember, lymphocytes kill cancer, fungus, and your cancer, fungus, and virus. They don't kill bacteria. So that's what a lymphocyte does. This is a T cell attacking the cell directly, okay? Penetrating that cancer cell to be destroyed. Now the B cell is the one that creates your antibodies. These are the antibodies created by that B cell, and the B cell will then agglutinate those antigens, okay? Again, that is going to be at your physiology class. So the main point is we got 2 kinds of lymphocytes, T cells and B cells. And the purpose of this lymphocyte, it kills fungus, virus, and cancer, okay? Now, let's go down to the monocytes now. The monocytes becomes phagocytes. So take a look at this monocyte. It's literally eating up those bacteria, okay? So this is a bacteria, okay, that is trying to eat. And that's what a monocyte looks like. And remember, the shape of the monocyte, the way to identify a monocyte is the shape of its nuclei. Okay? All right, so now, what is a platelet now? That's the last cell that we're going to be studying, okay? A platelet is a cell coming out from a big cell called a megakaryocyte. A mega means large, karyo means nuclei. It's a cell with a large nuclei. So they fragment into small pieces. So this is a megakaryocyte in your bone marrow. And then they actually go into the blood vessels through the pores and they fragment into small pieces. This fragmented pieces is what we call platelets. Okay, so they came from a big cell with a big nucleus called megakaryocyte. And the function of this platelet is to clot, and to clot is to stop bleeding. Okay, again, this is going to be at your physiology class. Okay. All right, so this is a summary of what we talk about, okay, on our form elements, okay? Talk about the red blood cell, talk about the white blood cells, and divide it into cells with granules, those are my BEN, and cells without granules, those are my LM, okay? And then the last one is the platelets, and these are your values here. Very important, okay? Because remember, those are the values that you actually need in order to diagnose patient. Okay. And blood cell formation, you call it hematopoiesis. If you take a look at this, okay, as blood stem cell divides into a myeloid stem cell and a lymphoid stem cell. The lymphoid stem cell can only create the lymphocyte, T cell and B cell. The myeloid stem cell, this is the one that can create platelets, monocyte, my bin, and my red blood cell. That's called myelocyte stem cell creating all of this, and lymphoid stem cell. And remember, you probably heard about ALL and CML, acute lymphocytic leukemia. So lymphocytic, these are the ones that proliferates. And we got chronic or acute or chronic myelogenic leukemia. And these are the cells that proliferate. Okay, so that's exactly what you hear when you hear somebody with leukemia. Is it's ALL, CML, and then that is the definition of the different kinds of leukemia based on its hematopoiesis. Okay, and then red marrow is the one that generates your blood cells. Okay, especially at the spongy bone. Okay, and yellow marrow, it's dormant. It's made out of fat cells. Okay, it used to be active back then when you were young, but now it's mainly dormant, so it just actually contain fat cells, the yellow marrow. Okay, and you've probably seen about this information that I mentioned. Your blood cell divides into a myeloid and a lymphoid. Okay, and red blood cells progenesis. Generally, you're going to have this one, very important. It actually will produce what we call a cell with a nucleus before it actually becomes a cell without a nucleus. This is a cell with a nucleus of a red blood cell. We call it reticulocyte. Now, if there's an elevated amount of reticulocyte, it actually shows you a diagnosis of bleeding. Okay, so that's one of the things that we remember, that reticulocyte, elevated amount of reticulocyte, that means that somebody's bleeding inside, and that is the diagnosis of bleeding. Okay, and what we talk about is the same as the hematopoiesis here. And some of the disorders, when you say polycythemia, excess of erythrocyte, wouldn't that be good? Okay, not always, because remember, if you got too much of erythrocyte, it actually makes the blood more viscous. Okay, and these are the people who live in Big Bear. Because of the oxygen density on the Big Bear, there's less oxygen on the mountain. They tend to proliferate red blood cells to compensate for the less amount of oxygen content. That's what polycythemia is. And then anemia can be a decreased amount of erythrocyte or hemoglobin. Okay. And then sickle cell is an inherited condition in which it has a defective hemoglobin, producing the shape, distorted shape of sickle. And then hemochromatosis, it is inherited abnormal excess of iron. Okay. And that's actually for hemochromatosis, too much iron. Okay, and leukemia is a disorder of leukocyte, and it becomes cancerous. Okay, so if you have an infection of 12,000 for white blood cell, okay, what do you think leukemia would have? So the number of white blood cells is going to be like 250,000. Now, so if there's a lot of white blood cells, why do they still wear masks? To prevent themselves from getting infected. I thought they have a lot of white blood cells. So why do they protect themselves by wearing masks? Because, so the 200,000 white blood cells that I produce, they're not useful. They're immature. They're cancer cells. It's if they don't have white blood cells. Okay? So that's the reason why they don't have those white blood cells, so they actually need to protect themselves by wearing masks. Because people's viruses can actually kill them. Okay? So even though they have those 200,000 white blood cells, they have to isolate themselves. They have to wear a mask in order to protect themselves against the virus that they might get infected with. Okay, so that's what leukemia is. And then thrombocytopenia. Penia means deficiency. So if you have deficiency of the platelets, you have a lot of bleeding. Okay, you have a lot of bleeding. Okay. So again, blood cells develop earliest in blood vessel, life in the blood vessel, but they become a major hematopoietic organ at the bone marrow, and at that is starting at 7 months. Okay, so that is what we actually are finishing up today, which is actually the blood cell. Our lab is going to be about your understanding of how we take a look at your different blood cells. Okay. So take a look at erythrocyte. It's pink red on your erythrocyte. No nucleus there. White blood cells have nuclei. Okay, and nuclei is blue purple, and cytoplasm is about pale blue. But you also have granules for the neutrophils, the eosinophils, the basophils, and these are your color for those granules. Okay, and one of the most important things, the eosinophils, it's actually orange red, very obvious. Now, if you go through our basophil, take a look at the granules that are dark blue. Okay, eosinophil, the granules are reddish, orange, and in neutrophils, the nucleus, the granules are pale, but the only way we can identify it's the number of lobes of the nuclei, about 2 to 6 lobes. Now, for the lymphocyte, the nuclei, there's no granules here. The nuclei is as big as the cell. That is going to be your lymphocyte. And then on the monocyte, the nucleus, then also no granules, the nucleus is kidney shaped, okay, on your monocytes. Okay, now this is the differential count. It's made out of your BEN. These are your granulocytes. And then we have the LM. This is your agranulocytes. We call it diff count. Right, so now let's take a look at red blood cells first. Okay, my erythrocyte is central pallor, no nucleus. It's pale in the middle. That's what erythrocyte is. Now I'm going to start with my cells with granules, my BEN. Okay, basophil. Okay, see the granules are dark blue. Okay, it's a basophil. The granules are dark blue. I couldn't even see the nuclei inside. That's a basophil. Then we're going to take a look at eosinophil. Now, you see that the granules in eosinophil, they're red-orange. Okay, easy to identify. And then the last one is neutrophil. So the neutrophil, okay, it has these lobes of nuclei obvious on the cell. So that's going to be my neutrophil. Now, we're going to take a look at my lymphocyte. We've got lymphocyte monocytes, no granules. Lymphocyte, the nuclei is as big as the cell. That's a lymphocyte. Nuclei is as big as the cell. Then my monocyte, with the largest white blood cell, it has this kidney-shaped nuclei. Okay, and then the platelets are fragmented cells within the matrix or the plasma. So these are your platelets. Okay, so that's how we identify the different blood cells. Now, again, erythrocyte, central pallor. And then I got my basophil with dark blue granules. And I got my eosinophil, red granules. And then my neutrophil, okay, pale granules, but I see lobes of the nuclei for the neutrophil. So I follow my bend. And then after that, L, lymphocyte, nuclei is round and as big as the cell. And then my monocyte, the nuclei is kidney shaped. Okay, so that's how I identify the platelets are fragmented cells. Okay, so now we see here about our erythrocyte, central pallor, no nuclei. Then I'm going to go through my white blood cells, the granulocytes, basophil first, dark blue granules. And then after that, eosinophils, red granules. Then neutrophils, the only thing I can see is the lobes of the nuclei, about 2 to 6 lobes. That's for neutrophils. I'm going to my lymphocyte. The nuclei is as big as the cell. Okay, and my monocyte nuclei is kidney shaped. Okay, so I did lymphocyte monocytes, and my platelets are fragmented cells. Okay, so very easy to identify, and you got lab exercises to actually identify this also to help you out. So eosinophils, red granules. Okay, so they're red granules. That's for eosinophils. Another is eosinophil, reddish granules. Okay, and then another eosinophil, red granules. And then basophil, that is going to be dark blue granules, very dark blue granules. Then picture of basophil, not as dark, but you see a lot of this dark granules, and I couldn't even see the nuclei inside. Okay, not very obvious. And dark blue granules again, basophils. Now neutrophil, pale granules, but you can only see lobes. These are the lobes of the nuclei. Okay, they're literally connected to each other. So it's neutrophil, another picture of neutrophil. Okay, pale granules, but you can actually see the lobes of the nuclei. Okay, now take a look at this picture. If I see this on the blood smear of a patient, I see a lot of neutrophils. So that means this patient has a bacterial infection. Okay, so I would assume that the neutrophil value is high. Remember, my men in black. Monocyte neutrophils, basophils equals bacteria. Okay, so that's how it looks like on the blood smear of a patient with a bacterial infection. A lot of your neutrophils. Now, for the lymphocyte, nuclei is as big as a cell. Okay, that's going to be a lymphocyte. Then nuclei is as big as a cell. That's for lymphocyte. Again, lymphocyte, nuclei is as big as the cell. Then granules, no granules there. Now the monocyte, okay, now take a little difference. A monocyte, sometimes the nuclei is quite looking like a kidney, but sometimes they have some differences, okay? But I know this is without granules, so this is what a monocyte is. And some of the lymphocyte, medium, large, and small, sometimes they can configure a similar shape of a kidney, okay? But remember, it's more rounded than the monocyte. Again, this one, sometimes it configures like a kidney, but generally it's rounder. So that will be the difference between a monocyte and lymphocyte. Sometimes you get confused with them. But remember, the monocyte exaggerated the kidney shape. Now, this is a monocyte. You can see that it is a kidney-shaped nuclei. Okay, monocyte again, kidney-shaped nuclei. Okay, and our erythrocyte, okay, central pallor, pale because biconcave in shape. Okay, that's going to be for the red blood cell. Now, this is a red blood cell. This is called a rouleau formation. A rouleau formation is seen only on a slide. So sometimes when we put a blood smear in a slide, they stack up like coins. Okay, and that is actually called a rouleau formation. Stacking like coins. Okay, that's phenomenon. But in vivo, it doesn't actually have that way. Okay, it doesn't stack up like coins. Erythrocyte again, remember biconcave on both sides. Okay, platelets are fragmented cells. Remember, they came from a big megakaryocyte with a nuclei. And then when they actually are released to the blood vessel, the bone marrow, they become fragment cells, and that's the one for clotting. Okay, again, small platelets around the plasma. Now, some of the abnormal pathology, this is the shape of a sickle. Okay. The problem is the hemoglobin protein that produces this shape, the sickle cell anemia. Now, this is called spherocytosis, round cells. Okay. The defect is about the erythrocyte membrane. It allows sodium to come in, and that's the reason why when sodium comes in, water comes in, so they actually appear like round. Like, for example, this one, I don't see central pallor here. Okay, no central pallor. So it is spherocytosis. Okay, so that's how spherocytosis look like. Okay, now this is megaloblastic anemia. Okay, those are the people that lack the vitamin B, B12 and B9. They lack vitamin B, so what happened is their cells becomes big. Megalo means big. And then sometimes they look like a teardrop. Okay, so these are the people who lack those vitamins.